Okay. Good afternoon, everybody, and welcome to our Support After Stroke. We are not live streaming today, but we will post up for you guys tomorrow to see the entire conversation. And just a quick reminder that we wanted to let everyone know that our goal for post-stroke support is to help reinforce discharge information while exposing stroke survivors and their caregivers to current information on how to navigate life after stroke through these virtual monthly talks. And we have the pleasure, and I do want to emphasize that, of having Joy with us today, who's a registered dietitian, if I'm not wrong with that, correct? As well as a registered nurse, to have a conversation with us about the importance of stroke, nutrition with stroke. And as we know, globally, stroke is 80% preventable through modifying our risk factors. And the biggest piece of that is our diet. Is that not right, Joy? I'm going to let you take it away.
It is. So, thank you very much, Samantha. I'm glad to be here. Yes, I am a registered and licensed dietitian, and I work here at Halifax in the cardiac rehab program, also our weight management program, and the outpatient nutrition therapy. Sometimes I put on a hat and help with the transplant program. So let's just jump right in. I am very glad to have a very focused topic to cover today, and that is nutrition for preventing a future stroke. And we have some areas that we would like to explore. I have my first point is the things that I am not going to talk about today, just because it is a huge topic and more than what we can do with this presentation. And then we want to evaluate what are your possible risks that are related to nutrition, and are you accomplishing, how are you doing right now? Maybe your diet is fabulous, and so how do you evaluate your diet to see what you're doing right and what things you might need to modify? And then what are some of the specific recommendations to prevent a future stroke? And then I want to give you some tools for guiding your changes. And so these are the things that I am not going to focus on, but I think that we probably need a topic like this for your support group. And that is having a stroke certainly does change just the mechanics of eating and drinking. You may have challenges just remembering to eat and drink. You may not feel like eating, and then you lose weight, and then you're not as strong, and you can't do all the things that they want you to do in therapy. And maybe a stroke has changed your body's ability to chew and swallow the way that you used to, and all of these things can lead to changes in your skin. And maybe you sit and you sit and you sit and you don't move around very much, and then you wind up with a wound that takes forever to heal. It gets infected. So these are like, you don't want to go there, but they are things that probably you want to talk about. But you have challenges communicating, and maybe you can't say what you really want, like chocolate ice cream, please. And then we have pride too, and asking for help is annoying. And so and then if you do decide that you want to ask for help, there's all kinds of obstacles that you encounter. And so this is a slide for what I think you want to talk about down the road, but not today. But if you do decide that some of these things are things that you want to talk to a dietitian about, ask your doctor for a referral. I will give you some inside tips on that. If you have Medicare, your insurance will cover if you have a diagnosis of diabetes or chronic kidney disease, stage 3 through 5. It will not cover that you had a stroke, or that you're on a tube feeding, or that you have a wound. It's a bizarre system, the way that we have our insurance and covering things that are really important. There are some insurances that will cover a visit with the dietitian if the doctor applies for a prior authorization, and I can help you guide through that. And then you may just decide it's worth paying out of pocket for that. So let's move on and get to the topic of the day. Samantha shared a fabulous article with me, just a summary, and this thing called GRADE. That stands for Grading Recommendations, Assessment, Development, and Education, which is a mouthful, but basically it's what we use when we don't have a sure, a definitive recommendations. So it's kind of like, how do we shake out the best stuff that will guide us for our future decisions? And so I'm going to go with the consensus, because actually for nutrition recommendations to prevent a stroke, we don't have a cut and dry line. So these are going by what's currently kind of assumed as. Hopefully we're on the right track, but they keep doing more studies and hopefully we'll get clearer recommendations. But I think we're on the right track. And so today
Perfect.
we're going to talk about the, am I going too fast?
No.
Okay. And
but you might want to take a breath.
I got to be careful
you're doing
of
great.
time too. Okay, so basically what we want to do is kind of look at your whole health and what things, your blood pressure is important, your cholesterol is important, your blood sugar is important. What about your weight? Are you eating enough fiber? Do you have more of a animal food based diet or a plant-based diet? And then because I also work in the wellness center, I have to make a plug for these other things that aren't really nutrition related. And that is, if you're a smoker, you need to become a non-smoker as soon as possible. And that goes for smoking anything, smoking cigarettes, smoking marijuana. I just attended a workshop on Friday, and the smoking of marijuana can increase your risk for a stroke. So there, I said it. And then we need to move. I'm sure that you've talked about movement in this recovery, because I see that you work with the Brooks Rehab program a lot. And then the whole question about alcohol, we'll touch on that a little bit as we go along. So now we're taking stock, and we're going to focus on just like doing a little snapshot assessment. Things that are kind of in your realm of, you could do these things. You don't have to have a doctor visit to figure out these things. What's your height? What's your weight? And then if you visit the cdc.gov, they have a BMI calculator. And so you put your height and your weight in there and find out what your BMI is. BMI stands for Body Mass Index. It's basically how much weight you can carry for your height. And we'll look at a table, and hopefully that'll make it a little bit clearer to you what is a BMI. The other thing that research has shown is where we carry our weight is important. And if we carry it more in our chest and kind of a barrel-shaped people rather than pear-shaped people, that can increase our risk for things like stroke. And so these are measurements that you can do around your waist. You just get a sewing tape measure and put it around your waist in the smallest spot. Usually the tape measure winds up hitting around your belly button. And so then you know you have your tape measure in the right place. And it may be helpful to have somebody that you trust do your measurement for you, because not everybody likes having somebody so close. So this is a BMI, just one version of a BMI chart. And basically you find your height down the side here with the black, and then you find your weight across the top in the blue. And when you draw a line down and a line across, let's say you're 5'7" and you weigh 240, so your BMI would be 38. And you're in this orange zone, which is obesity class 2. And if you were in the red zone, like I weighed 260, now I'm in the extreme obesity, or another word they use for that is morbid. And the word for morbid is it could kill you. So you don't want to stay there. You say, I got to get out of here. And so you drop down maybe 30 pounds. Okay. And now we're out of that zone. And if I drop down 10 more pounds, I drop 2 more points. And what's important here is that every time you drop down one number, you have measurable health benefit from that. And then, of course, the goal, ideal perfect world, is to be down here at BMI 25 in the normal weight range. I have met very few people that are over here in the ideal body weight. So I don't know that you have to necessarily get there. I'm all about progress. Are we moving in the right direction? So hopefully that paints a picture of hope, and you might need to ask for help for that. Some other numbers to consider, probably you get your blood pressure checked every time you're at the doctor's office. And some of you are probably checking your blood pressure at home, which I think if I had like one of those emojis that claps hands, I would definitely give you one of those, because that's one of the things that helps you detect issues before they become issues. So we try to be 120 over 80 or less in the green zone here. And then another number. Now, remember I told you about that grade approach to determining what are good recommendations. This is an example of some of the research that they have these gradings over here, A and B and classes. And so a person has to sift through all of this. Basically, you're trying to find out, well, do you have a cholesterol number that I'm supposed to shoot for? And the goal for most people is to have the LDL, which is the so-called bad cholesterol, be less than 100. And they think that some people might even need to get down to 70, and they might use some statins, or on this line, they might use all these nutrition recommendations that we're talking about today. And then there's the good cholesterol, but the good cholesterol could be low, and so they might use some medicines to help it go up, like niacin and gemfibrozil. I'm not sure I'm saying that right, but you know what? You can also make HDL go up with exercise, like strength training, and it doesn't have to be big weights. It could be a 1 pound weight, a 2 pound weight, and that can help your HDL go up, as well as eating some of the healthy fats that we're going to talk about. But this is one of the slides I found that was specific for preventing a future stroke. So they are working on it. And then we have the blood sugar side of things. So if you're thinking that you don't know, do I have diabetes? Do I have pre-diabetes? They will say that you have diabetes if you have 2 fasting blood sugars in a row that are over 126. And if you have a blood sugar that's less than 126, but 100 and kind of in this window, you might have pre-diabetes, and that increases your risk for a stroke. And I'll make a plug for Halifax has now a fabulous pre-diabetes workshop that you can sign up for, and you call Micah Lil, and her phone number, I have it here, 386-425-5210. But if you want to learn more about pre-diabetes, that is an awesome 12-week workshop. Right now it's Zoom, but I think they want to go in person too. But that would be when you're ready, you might check that out. All right, so we took a look at numbers. Now let's take a look at the food, because that is the whole point of this session, right? So this is a quick way to take a snapshot. How is my diet? Think about, what do you like for your protein? Is it red meat all the time, or do you choose some fish and chicken? What about the carbohydrates? Do you like whole grains, or do you eat white bread and white rice and white potatoes? And those might get you in trouble. So we'll talk more about that. And then I do have a little question about calcium. Do you like whole milk, or maybe use soy milk? Or I'm just like doing a teaser here. And then what about fruits and vegetables? Do you have every color of the rainbow every day? And this go-to fat, that is like, if you're getting ready to cook something in the kitchen, what do you grab to start your cooking? Do you grab olive oil? Is it butter? Hopefully nobody has a Crisco can anymore. And if you have a tin for bacon grease, go in your kitchen and throw it away. That's my first recommendation here. And then think about your beverage. So I know you can't read this, but it is a fabulous tool, and it's one of the tools that Samantha posted on the Facebook page today. And basically, it has 14 points that ask about a Mediterranean diet, and you want to have as many yeses as you can. This is a yes column and a no column. And if you mark no, then you can read the what could I do differently so that it could be a yes. And if you have all yeses, then you are following a Mediterranean style diet, which is very cool. And then this teeny tiny print up at the top is saying that for every 2 no's that you make yeses, you reduce your risk for a stroke by 30%, which is pretty fabulous. And these are really tasty things to do. So let's get into what are those tasty things to do. We want to eat enough, but not too much. And then for blood pressure, because they call high blood pressure the silent killer. And salt is a huge contributor. We have a target for how much sodium or salt we can eat in a day. There's a range here, and that is because some people are taking medicines to control their blood pressure. They're taking medicines to control AFib. Then you would be on the 1500 milligrams per day range. And if you're not taking lots of medicines for your heart, then you would just be on the normal recommendations, which is 2300 milligrams a day. Most of the people I talk to that have had a stroke are on the low side here. And the average American probably eats 4 to 10,000 milligrams. So this is like a fifth of what the average person eats. And I have a feeling that average is dangerous. So let's not be average. Let's be extraordinary. And so let's go on. I don't want to run out of time and tell you about the most important thing. So we want to have a diet that's healthy in the quantity of food that we eat and also the quality of the food that we eat. And so this is just to give you an idea of a strategy for meal planning. I want to have a protein kind of food that's about the size of a small lady's hand, 2 to 3 ounces probably. And then I want about a half a cup of some kind of starchy grain. It could be, I'm going to have a sweet potato. It might be a little pile of rice. It might be some potatoes. It's not taking up the whole plate, but it's there. And then half of my plate is going to be with colorful fruits and vegetables. And this dairy doesn't have to be necessarily dairy. If you have issues with milk, sugar, or you're allergic to milk, you might use a dairy alternative. But it's here to tell you, it tells me to ask about calcium rich foods. And then that color, isn't that pretty? Lots of color. And so because salt is such a big part of this, I want to keep my blood pressure down. I just give you a list of foods that if you're not sure where the salt is, these are some places to start. And the salt shaker has some too. 1/4 of a teaspoon. You can put out this restaurant food. Did you know before COVID, 70% of the food and the salt in most people's diet came from restaurant food. You can clean it up from your diet at home and still be, if you're getting takeout during COVID because you don't want to cook or you're not up to it, be careful with that restaurant food. So when we're reading food labels, we want to be a salt detective and shoot for, this is if they're making a claim on the label. If it's going to be low in sodium, if they make a claim that it's low in sodium, it has to have 140 milligrams or less. And if our target is 1500, we got like 10 choices before it's all gone. And if you go and get some wings or ribs, you could easily get 2000 and have most of your sodium gone in one meal. So we have to, in order to get that 1500, we really need to be good detectives and check out the food label. So here, this is saying based on what they say is a serving size. In this case, it's 2/3 of a cup of stuff. Then they're saying in 2/3 of cup of whatever this food is, there's 160 milligrams, which is pretty close to that low sodium. I'd probably eat it for the salt side of things. And I want, while we're here, to go down here and look at the sugar too. This food has a bit of sugar, so I might not eat it after all. Every time you see a 4 or a multiple of 4, so if it said 12, that would mean it had 3 teaspoons of sugar in it. So we want to look at the added sugar. This is sugar that isn't occurring naturally in this food. So they added it. It does have 2 grams that occur naturally. So maybe it has some raisins, and the raisins have a little sugar, but then they added a bunch of sugar too. And the very last line tells you about potassium here. Okay, so sugar. Now I gotta flip ahead on my notes here because I had some things I wanted to say about this slide. You think that if you're trying to prevent stroke, that it's all about salt, but I'm telling you that too much sugar is the underlying cause for a lot of these risk factors. So we can have some sugar, and for ladies, they estimate that 6 teaspoons or 24 grams in a day is part of a quote unquote healthy diet. And then for guys, that would be 9 teaspoons times 4 is 36 grams. So if we went back to that food label, I got 1/3. If I eat this food, which is only 2/3 of a cup of stuff, if I eat that, I'm using up 1/3. If it's 36 grams, I'm not sure I want to use up all. I might want to eat something else. So I think that one of the things that you want to do is look for this to be 4 or less as many times as you can, so that you have some legal room for other stuff you want to eat. And when we cut back on sugar, which is kind of an acquired taste, we get it. We can get used to these things, but we can also get used to things that aren't so sweet. We can reduce our risk for stroke. It is part of the DASH diet, which is dietary approaches to stop hypertension. So it can help your blood pressure go down. It can help your triglycerides go down, which is part of that cholesterol story. It can help reduce your risk for cancer. It can help your body have a lower insulin response. And when insulin is chronically high, then we have an increased risk for inflammation. And they're thinking that inflammation is the root for why do we have obesity? And why do we have all these other chronic diseases? So sugar, we need to cut it out. Cut out that sugar. Okay. So one thing that I think a lot of people with heart issues think, oh, I can't eat any fat. And that story, we have really changed our tune on that. And it's not no fat anymore. Instead, we're all about trying to get heart healthy fats. And this is a beautiful picture of heart healthy. And so to summarize, what's a healthy diet? You want to have a Mediterranean DASH, dietary approaches to stop hypertension style diet, or be moving in that direction. And as your dietitian, I think that we need to keep in mind the basics too. And that is, are you eating 3 meals a day? Maybe you want to have some snacks. If you don't have much of an appetite, you can use some healthy snacks. And are you getting foods from each of the food groups? And that's not really part of the DASH diet, but that's just, are we eating healthy? And can you get at least 5 servings of fruits and vegetables every day? That would be every color of the rainbow. Are you eating, the recommendation is for fish to be 3 times a week. And it could be seafood, it could be shrimp. I hesitate saying don't ever eat fried. For some people, this is the only, if they ate fried, it's the only way that we'll get any fish. So I might make exception for people who are not big fish eaters, that they could have a fried fish when they, but you're recording this. Maybe I should not say that. All right, so beverages, this is a sneaky place to get too much sugar. So try to choose things that are low and no sugar and low and no calories. So your water is going to be good, coffee, tea. And then, did you see that? No salt, no sugar. Some other things to keep in mind when you're choosing, there does seem to be a little bit of debate about whether does this need to be low-fat dairy? But I think most of the things I read said yes, choose low-fat. So we want to stay away from whole-fat types of dairies. And then some other, you see a lot of plant-based proteins here, nuts and tofu and beans. And we're trying to move away from red meat and onto these plant-based. And whole grains, they're actually kind of pushing towards intact grains. So when you eat oatmeal, that would be an example of an intact grain. And brown rice would also. And then alcohol, 3 drinks for reducing a risk of stroke. 3 drinks, or what? Not 3 drinks, but 3 glasses of wine for Mediterranean diet recommendations. I have some thoughts. I called them special thoughts because of that first slide that I showed you about the things that we're not going to talk about. I just think that if you do the DASH diet, that's a lot of chewing, a lot of chopping, and a lot of cooking. And so you might need to do some modifications for things that are easy to cook, things that are easy to eat, things that are slightly convenient. And so things that you might do like stews. If you do a sandwich spread, that's easy to chew, but maybe use olive oil mayonnaise to mix it, or some yogurt on that. Yogurt can be a food that gets you a lot of sugar, so you might get plain yogurt and add like a fruit spread in there or some chopped up fruit to give it a sweetness. And then nut butters. Nuts are a food that's easy to choke on. So a way around that, you could get, they have peanut butter, they have sunflower butter, almond butter. That would be a way to get it without it being hard to chew. And then I have revamped casseroles here. Traditionally, casseroles, you use some Campbell's soup, and that's high in sodium. So you check out the websites with the American Heart Association and the Diabetes Association, and they'll give you some tips on revamping these casseroles. Refried beans could be a way to get protein, and hummus is easy to chew, and that's made from ground chickpeas. The last one is I want to make a plug for using canned fruits and canned vegetables. It is okay because these are going to be soft, easy to chew, but get the ones that are packed in their own juices. And for vegetables that are canned, get the low sodium ones. And avocado, there's a fat that helps that HDL, the good cholesterol, go up. So it's easy to chew too, and high in potassium.
So can I just interrupt one quick question?
Yeah.
I have a question in the slide about veggie burgers.
Veggie burgers. That would be, I would read your food label and see they're not all created equal, and it could be a plant-based food, but look for the one that doesn't have really high sodium. I think that a veggie burger could be.
That's what I figured.
Yeah.
It was me, Joey.
Oh yeah.
Just the Spanish in me likes, to have meats, and while Patricia and I try to stay away from as much red meat as we can, every now and then you gotta have a burger.
Yeah. Those some of the veggie burgers are you would never know if you didn't.
Right.
Somebody.
That's right.
So just watch the sodium content.
Okay, thank you.
Not all food is made the same.
That's true. That's true. And so this last slide is to tell you about a fabulous website. It's called Old Ways. And I will give you a tip. This down here says Old Ways PT. You want the PT on there, because if you do Old Ways, just put in Old Ways, you might wind up on a very strange website.
I put the link on Facebook,
Yeah.
on the Facebook account.
They have really nice recipes, and they also they have a tool, like, let's say you got some beets and you don't know how to cook beets. They have like 10 ways to cook beets, 10 ways to cook onions, 10 ways to cook, and it's usually very affordable recipes with ingredients that you might already have in your house. and they have a beginner's guide. So how do I take myself from, I don't know what you're talking about, Mediterranean diet to something that might be closer. So it's a nice website. I like these people dancing down here.
Activity, very important to keep the activity up.
Yeah. And they do have sweets. They're up here, teeny tiny. Okay, Raphael?
I know, I saw that. Another question, I see the bread. And,
Yeah.
we all are eating, again, the Spanish diet is full of grains and breads.
Uh-huh.
And, we either lie to ourselves or not that it's whole food or multigrain bread and all of that. So,
If we
I
go
don't eat
back to
bread every day anymore, but I eat it 2 or 3 times a week. So,
yeah. A whole grain bread, there are benefits of having the outside of the seed, the inside of the seed, and the energy that you get from the grain. So I don't think that it's bad to have grains, but like you said, you use moderation. And if you use that choose my plate guide, you're filling up half of your plate with the colorful fruits and vegetables. 1/4, it's kind of like a small fist or half a cup, a small fist, not a guy fist. Guys have really big fists. So a small fist worth of grains or a slice of bread would be fine.
okay, thanks.
Sure. Good question.
I don't think we have any other questions right now. But I think that information was wonderful.
I want to say the one other handout that you put on the Facebook is about tips to reduce sodium. And that walks somebody through an example of, I made a sandwich. How much salt am I getting? It's not just a piece of bread and the turkey and the mayonnaise. What else?
Right.
So that's a nice tool.
And that's also linked up on the Facebook page as well.
Mm-hmm.
We had them all put up prior to the conversation, so you could refer to that. And I also want to make sure that I'm going to put a link up for the DASH diet to refer to people to that. I think that they have that for American Heart, right?
Yes.
And then who was the pre-diabetic workshop that you had? Who was the contact there?
Micah Lill. Her name is spelled MicaLill. Lots of L's.
Okay.
And
Yes, Micah, we're talking about you. Micah, we're talking about you. She's across from the office, Joy.
So if it's okay with Micah, I'm going to check with Micah and make sure it's okay with her. And I'll put her phone number with her contact for the pre-diabetic workshop on the Facebook page for our stroke patients, if it's okay with Micah.
She's coming. Hold on.
Okay.
You can ask her right now.
Wonderful.
Go ahead.
Hi, Micah. I wanted to know if it's okay if we can put your contact information for the pre-diabetic workshop up on our Facebook page for support after stroke.
Absolutely.
Will do.
Thank you.
If you want to send me a pretty visual, I could load that up too.
I can do that. That's even better. I'll do that.
Okay, great.
You thought I was kidding with you?
Once you get, he'll give me your contact.
Yeah.
Thank you.
Yeah.
Raphael has it.
Yep.
And I think we're going to definitely invite Joy back to have more conversation in depth in the little sections that we discussed earlier, because I know that Joy was chomping to go deeper. And I wanted to kind of go with a general overview to kind of introduce everybody to dietary changes first. And then we can go into more specific discussion, like with the difficulty eating and chewing and how we can make adjustments for that, et cetera, et cetera. Does that sound good with you, Joy?
Okay.
We won't make it happen right away. We will have time to plan and work it out. And, we'll definitely, I'll give you time. I promise not to harp on you, but if you have another thing that you think would be really awesome out of our conversation that you'd like to go more in depth, just touch point with me and then we'll pick a time that works for you.
Okay. Thank you.
Thanks. I really appreciate that. And I really appreciate you being here, because this is one item that I think gets overlooked and needs to be reiterated, especially for those of us who are looking for healthier avenues for reducing our risk for stroke and also modifying our diet to reduce our secondary risk for stroke as well. So diet has a huge piece. And like I say, it's only what you do for yourself that you can take into your own hands that you can make a difference. Perfect. Well,
so my contact information if anyone
perfect.
wants to get
Yes,
with me.
that is awesome. You're going to get a lot of info. I think a lot of people are going to be interested in touching point with you in regards to some direction with their diet and weight loss, because you do also monitor a weight loss clinic here too, correct?
Yes. Yes.
So I know we have that available to anybody who is in that BMI that's very high and they're very concerned about. You have a lot of different tools to offer them as well if they need to work on reducing that. And I wanted to kind of add that in for you.
All right,
Well,
you guys have a fabulous day.
Thank you too. Thank you very,
See you,
very
ladies.
much.
Yep, take care. Good job. Bye.